So what you should keep in mind is that the Nclex RN exam is not a test about recognizing facts. You must be able to correctly identify what the question is asking. You only focus on background information. So the new type of Nclex exam, at first it used to be just MCQs, but for now they have added case scenarios to it, okay, where they will give you a case study or a scenario about a patient. What they are trying to tell you at this moment is that you only focus on the data provided. You should never think back, what if this happens or what if this was there? No, just pay attention to the fact or the data that has been given onto you. Use whatever data they have and not think into the question. Okay, there is a saying that don't think into the question. Always use the data in front of you. Use the data that they have provided for you. And then in your field of practice, we have been saying that you need to use your critical thinking. So when we say critical thinking, it means that you need to use these various steps. So you need to observe. You don't just go and start doing anything. You have to observe, then you decide what is important. You look for patterns and relationships and you identify the problem. You transfer knowledge from one situation to another. You apply knowledge, discriminating between possible choices and all courses of action. Then you evaluate according to the established criteria. So in all the processes that you have to use, depending on which scenario you have, you can use any of the steps we are talking about, okay? And this is going to assist you in arriving at the correct answer choice. Okay, please let's pay attention because at the end of this, we will be answering some key questions, okay? Okay, so for the test taking strategies, you always focus on the data, like I mentioned earlier. You never think outside the box. Always focus on the data in the case study because they will be giving you the labs, they will be giving you the previous medical history, the presenting complaints, everything will be given. So focus on that data and do not use your previous knowledge you've observed in a different patient. Every patient is different, okay? Then you note the subject and determine what content is being tested. You visualize the event and recognize cues. So it's just like the previous steps we talked about, okay? Then you note if an abnormality exists in the data and analyze or interpret the data provided. So you determine who the client of the question is. You look for the strategic words. And when we talk of we will talk about it in a subsequent slides, okay? When we talk of strategic words, they are words that you have to take note of when it comes to answering of the questions, okay? Sometimes they can write best, which is the best procedure, which is the best this. They are all strategic words that you also have to pay attention to, okay? So this slide is mainly talking about how you should go about the Nclex examination and some other things you should avoid when you are given a case scenario. Then you also determine whether the question presents a positive or a negative event query. Then for traditional Nclex items such as the multiple choice. So like I stated earlier, in the past, it used to be just multiple choice questions where you'll be given a question and then they will give you the various options to select from. Now they have added case study. So the next generation Nclex, they will give you a scenario and then you will have to diagnose and determine the appropriate treatment, the appropriate lab investigations that needs to be done for the patient. Then remember that the NGN items you will have to ask yourself, what if? Because you need to think about and consider all existing and potential concerns, such as complications that can occur in the client. So for the NGN, before you even start your treatment, you always have to think, what if I don't do this at this particular time? What will happen to the patient? What complication is the patient going to have? Okay, all these have to come in your prioritization. That is when you have to prioritize between care of different kinds of patients. Then you can apply the NCSBN clinical judgment measurement model and the 6 cognitive skills, which we talked about. We said the recognizing cues, the analysis. Those steps are what you can use in assessment of your patient when it comes to the NGN question, okay? This NCSBN clinical judgment measurement model is very important, okay? We spoke about it earlier. The 6 processes that we talked about, the cues and then the analysis and all that. Then in answering the question, always use the process of elimination when choices or options are presented, okay? So for instance, you've been given a scenario and then you have to choose from an option. They are saying you should use the elimination method. There are certain questions that you could see that this thing does not even apply here, okay? So you first have to eliminate those things. Then you can think about what will fit, what answer will fit into the question at the moment. In multiple choice questions, you look for comparable or alike options and eliminate these ones. So if you are having words, synonyms there, words that means the same, it should tell you that the answers can never be any of the two. So it means you have to eliminate them. Okay. If you are planning of writing Nclex, I am saying that these slides are very important. This particular lecture is very important and it is going to guide you throughout your Nclex journey. And then also, you have to determine if there is an umbrella option. So maybe you have been given a question and then they are asking which kind of precaution to use. Let's say a patient comes with C. difficile infection. So for C. difficile, you know, they tend to have diarrhea, vomiting and all that. It's a GIT infection, okay? What precaution are you going to use? They can say that put on gloves, put on a apron, okay? And then you are seeing use contact precaution. If you are to select just one, if you say put on gloves, what happens if the patient, if there is a secretion that is going to splash on you? Okay, it is not going to be helpful. Are you going to leave the gloves and say you put on the apron? No. So you choose the umbrella option. If you choose a contact precaution, you know that it applies, it covers everything. It is going to cover the glove, it is going to cover the apron, it is going to cover a face shield. Okay, always think about this. If there is an umbrella option that will fit in at that moment, choose that option and you always go correct in answering your exam, okay? And then you also identify any closed-ended question if present. If there is a closed-ended question, so at this moment you should know open-ended question and closed-ended question. So for open-ended question, it means that you are giving the patient room to also talk. But then if it is a closed-ended question, it only demands a yes or a no answer. So if you are seeing a yes or a no answer, then you have to rule that out. It can never be an option, okay? And then you can also use the ABC, that is the airway, breathing, and circulation. In prioritization, using of the ABC, using of the Maslow hierarchy of needs. So depending on where you find yourself at the moment, these are the various options you can use, okay? You can use the ABC option. You can use the Maslow's hierarchy of needs. You can use the NCJM, which is the NCSBN prioritizing tools we talked about. You can also use that, okay? And then if CPR is also needed, then you know you are using the CAB, which is the compression, airway, and breathing, okay? And then in answering or in speaking with a patient, therapeutic communication is very important. Okay, so in our subsequent slides, we'll talk about what therapeutic communication is. It is very important in talking to a patient. So in therapeutic communication, you should know all the things you are not supposed to say to a patient. For example, you should never ask a patient using the word why. Why did you do this? Why did you go there? Okay, it is not allowed. So if you see an option where they are saying why did the patient do that, never choose that option. It's wrong. We never use the word why. Okay, so therapeutic communication is also very important in care of our patients. And then use delegation and assignment making guidelines to match the client's needs with the scope of practice of the healthcare provider. Now, you should also know the work of every professional in the workplace. You know the registered nurse. Aside registered nurses, we have licensed practical nurses. We also have licensed vocational nurses, nurse assistants, okay? In the US, these are the various nursing types we can have. And you should always know their job description and do not delegate what they are not supposed to do. That is what they are talking about here. And then you use pharmacology guidelines to select the correct option if the question addresses medication. So for pharmacology, if you don't even know the drug, okay, you can just, there are various drugs. You can just use the ending of a particular drug. For example, if you are supposed to give a patient a beta blocker, maybe you've never heard a drug before. You know, beta blockers ends with the letters LOL, the LOLs, okay? Labetalol, propranolol, all those things. So if you have never heard of it and you are seeing a LOL there, it should tell you that it's definitely talking about beta blocker, and this is going to assist you in answering your question in case you know you have no knowledge about the medication.